I'm State Senator Cameron Bartolotta, and I represent Greene County, almost all of Washington County, and parts of Beaver County. And I am here today with a wonderful individual, and we are going to be discussing the benefits of my upcoming legislation, hopefully upcoming, Senate Bill 25, which allows nurse practitioners full autonomy. And this is an incredible example as to why it is so vital. And nurse practitioner, Ms. Lynn Heard, is with us. Give us your experience as to what happened leading into the COVID pandemic, if you would, Lynn.
So I have been a nurse for over 40 years. In 1995, I went back for my nurse practitioner. And so I actually served in two roles. I worked in a family practice for many years, over 20 years. And I also worked in a school setting as a nurse. Previous to that, I had extensive background in med-surg, intensive care, hospice, home health. So it was quite a varied background and experiences that I bring to my role as a nurse practitioner. So when I started the nurse practitioner role, the patients really developed, an interest in my role, and they enjoyed and repeatedly came back to see me versus seeing the doctor because they felt very comfortable. But unfortunately, he took a new position and I was left without a collaborating physician. So without a collaborating physician, I was very limited in what I could do as a nurse practitioner. So I had patients that had wanted to continue to see me. They've been seeing me for 20 years, and I just had to say, I'm sorry. I've tried multiple avenues to find a replacement collaborating physician. I have written to many organizations trying to get help in finding a collaborative physician, and I was not able. To this day, I get phone calls from patients and say, please tell me that you found someone and that I can see you again and you can take care of me. And unfortunately, that didn't happen. So I really do appreciate you moving forward with that.
So Lynn, you've been a nurse for 40 years. So yeah. I'm sure you have not only been a wonderful resource for excellent healthcare to numerous patients, but also have seen their children and their children's children. You know these families, they feel comfortable with you, they trust you, you know the medical history of these individuals. And it sounds to me that you've pretty much stayed in the same place for quite a long time.
Actually, I was born and raised in the area, so I know,
you know everything.
Like, we go into a store and my children and grandchildren say, is there anyone you don't know? So we always joke about that, but they're like my family. The patients are, and like you said, I do know their children, and, I grew up with them, and I, they value my opinion and my care. So I think that's so important. And I would just love to see them get the choice to decide who they wanted to see. So I think that would be fabulous.
And you were ready, willing, and able to give great health care to all of these individuals who you know personally, right in your home area. I mean, you grew up with these people and you were ready to give them a great health care, but were completely unable to. But to try to get some of these folks who were, for a year, a lot of folks that I know were terrified to go to the emergency room, or they waited so long because they didn't want to leave their home. They didn't know where to go. They didn't have a primary care physician that was anywhere close to them. And some people can't get to their doctor's office. And unfortunately, as is the case after a year of COVID, a lot of people lost their jobs, they lost everything, and now they're on Medicaid. And how many physicians do you know that will accept new Medicaid patients? It's just it's a revolving door. And we have an army of very well educated, very well experienced nurse practitioners ready, willing, and able to hit the ground running and take care of all of these individuals who desperately need and deserve excellent health care. And we are preventing that from happening. We're up to 23 states, the District of Columbia, and every VA in the United States that allows our certified nurse practitioners to do exactly what my bill would allow them to do. And some people might not know this, and maybe you can shed some light. During COVID, those nurse practitioners were allowed to work with autonomy because we needed them so much. So we gave a waiver, if you would, during COVID times, and there was not one instance where the medical care was substandard. So it's the case has been proven time and time and time again. Release this army of wonderful healthcare providers to do what we need to do and provide excellent healthcare. Can you tell me about some of your colleagues, perhaps, that you know of that had this agreement and were able to work autonomously during COVID?
I really can't reply to that. I don't know anybody individually, or personally that has had that experience. I do know in other states they were granted independent practice and that autonomy. In Pennsylvania, they still had to maintain that collaborative agreement.
It's wonderful to know that we have so many very capable people. Can you just give us another little rundown of your education? What puts you in the great position you're in?
Yes. So I received my bachelor's degree back in 1980. I got my master's with a certification as a family nurse practitioner in 1979, and I received my doctorate in nursing practice in 2012. So besides my educational background, I think it's the experience, that I have had with families and providing that one-on-one and that holistic patient care. And I'm not treating just an illness, I'm treating a family and and a patient.
So with this legislation, Senate Bill 25, to give certified nurse practitioners full autonomy after 3,600 hours and 3 years under a collaborative agreement with a physician, these nurses would only be allowed to practice within their scope, right? Only in their lane, in their scope of practice. So what would be your scope of practice?
My scope of practice is family practice. I'm a general practitioner. So I care for, if there's something I don't feel comfortable with, I am going to refer that patient immediately. I'm going to make the contacts that they need so that they can get the best health care that they need. I am not out to overstep my role. If there's something I don't know, I am going to do everything that I can for the safety of that patient and for their benefit.
So for the years and years that you were under a collaborative agreement, patients would come into the office and they would see you.
Yes.
And then you would see them and you would diagnose and treat and follow up and all of those things. But if you saw, again, just as you said, if you saw something that was beyond your comfort level, your expertise, or your category, you would immediately refer. Much like physicians do today, they refer to specialists.
Right.
If you need an orthopedist, if you need a cardiologist, if you need any of those things. So it's pretty much in line with what you've already been doing for so many years. Am I right?
Absolutely. And, my role really is to encourage people to be in the best health that they can be, to encourage them to get their screenings that they need, to follow up, to take care of, if they do come down with an illness such as diabetes or hypertension, to educate them on how to care for themselves. So, to work with them and to try to get them to be in the best health that they can be.
I agree completely. Yes. Well, again, Lynn, thank you so much. I really appreciate your time. It was wonderful to meet you and to talk with you. And I certainly hope that someday, very, very soon, I can invite you to the Capitol and take you around to the legislators' offices and you can tell your story face to face.
Great.
That would be great.
Great. Thank you.
Thank you so very much.